Yeah, it's not beer for my horses, it's beer for me. Hey, do you have a beer or two while watching football yesterday? Do you know that beer can be good for your health?
I had no idea, so I'm very excited for this segment because it'll make you feel less guilty when you're drinking it.
Dr. Mark Hong, with Affiliated Urologists in Phoenix, is here to talk about the health benefits of beer. Thanks for coming on, Doc. I appreciate it. So, beer could be good for you?
You know what? I mean, this is a kind of fun thing to talk about because we're in the season of Oktoberfest, the season of harvest. And it turns out there's a lot of good research coming out nowadays that is talking about the health benefits. For example, red wine and also beer.
Now, I used to read that when runners finish a run, like a long run, maybe 10 miles, having a beer was good for you. Is that still true?
You know what? I think it can or it can't be. You know, and maybe part of what I'm going to do today is talk about what it's good for and what it's not good for. Let's actually start with what it's not good for.
Don't tell me there's a downside to it, too.
Well, let's not, you know, I'm not advocating for everyone to go out and get wasted. Let's be honest about that.
Okay, but you start with stronger bones, you say that's one benefit?
Well, you know, so a lot of the health benefits we're seeing with beer have to do with cardiovascular disease. So actually one Italian study showed a 31% reduction in cardiovascular risk. The risk of stroke, high blood pressure, all of those things were reduced.
Okay.
Also with bone health, it has to do with the amount of silicon that's in the beer, so that's also been shown. Now, the important thing for me to mention, though, is it's always in moderation. And that is the key, because these studies, the same studies that showed better bone health, cardiovascular health, even decreased diabetes and cancer prevention, if you drank more than 1 to 2 beers a day, then actually increase your risk. So that's very, very important.
So just 1 or 2.
But isn't that always why doctors are somewhat hesitant to recommend beer because of the moderation aspect? Some people just can't grasp that concept.
And it's you know, it can be very difficult. But I think if you look at it more in terms of, for example, I'm not advocating saving up your points and then, you know, I didn't drink 5 during the week, so I can do all 7 in one day. That's definitely not what the studies show.
Okay.
So what's the difference between the light beer and the dark beer?
Let's talk about that, because it actually makes a huge difference in terms of the health benefits. Of course, light beer, we enjoy it, it's refreshing, but it turns out that it doesn't have a lot of the hop content that leads to a lot of the health benefits. So if you're actually looking to maximize your health benefits, now of course lighter beers have less calories, so that's always a consideration. But if you're looking at the cardiovascular disease, the cancer prevention, some of these angles, then going to a darker beer, and when we say darker beer, it's not just the color of the beer that matters. It's actually the hop content. There's hops, it turns out, hops and malt contain things like phenols and other compounds that have been known to prevent you from heart disease, from cancer prevention, those kind of things. So the kinds of beers that tend to have those tend to be more in the ales. And so you have lagers over here and you have ales over here. And among the ales, you're talking about things like pale ales or IPAs, India pale ales, and these have a higher hop content. You know, some of the features here, you know, Four Peaks and Oak Creek are local breweries. Of course, you can find pale ales everywhere. These are the craft beers that you were mentioning earlier. Now, one thing that I thought was really interesting is there was one study done. You know, this is a piece of rib that I grilled yesterday. It's pretty pathetic looking now, but you know. But what's interesting is if you marinate this in beer, see all this charred stuff, that's not good for you. That's going to cause cancer.
We hear that all the time, But
if you marinate this in beer, one study actually showed that it decreased the amount of cancer-causing chemicals when you grilled it by 70%. So if you marinate in beer, it may actually protect you against cancer a little bit.
Very good.
There's one benefit, of course, I haven't mentioned yet. There's an Australian study that talked about this phenomenon.
Break out the glasses.
Beer goggles.
Called beer goggles. And they actually showed that people actually saw each other as more attractive after they've had beer.
Oh, sure.
Now,
well, yeah, but that's not drinking in moderation when you break out the beer goggles.
We don't know if that's a benefit or a risk. I don't know. The final message, though, is please drink in moderation, because we have to be safe. You don't want to drink and drive, that's definitely for sure. But 1 beer a day for women, 1 to 2 beers a day for men. That's the recommended what we found in the research. But when you drink it and enjoy it.
I find it interesting that you're a urologist speaking about beer, because as Archie Bunker used to say, you can't buy it, only rent it. What's the name of your practice again?
Affiliated Urologists. We have locations in Phoenix and Scottsdale. And find us on the internet as well. Find me on markhongmd.com.
Does it help kidney disease at all?
Well, yeah. So actually, you know, we don't like to mention this as a way to hydrate yourself, for example, for kidney stone risk, but actually some studies have shown that drinking beer can help hydrate you, again, in moderation. But, you know, water is always the best thing for kidney stones, but, again, there's some evidence.
Yeah, okay.
Wow. All right,
Thanks a lot,
Dr.
Dr.
Hong,
Hong.
thank you so much.
Thank you, Rick. Thank you.
Let's have a beer.
Cheers.
Cheers.
After the show's over, cheers. Not right now.
Here's Corey.